Let's talk high blood pressure, also known as hypertension. This is a big topic. High blood pressure and hypertension are basically the same thing, although when you just simply say high blood pressure, that implies that you have transient high blood pressure. When you say the word hypertension, that kind of implies that you have a disease state known as hypertension. There's multiple different causes or underlying problems that can cause both high blood pressure and hypertension. Hypertension itself implies that there is indeed an underlying problem, sometimes genetic, sometimes diet-related, sometimes weight-related, sometimes physical inactivity, sometimes related to kidney function or dysfunction. So hypertension is a big, broad topic. There's many causes and a whole extensive array of treatment options for high blood pressure, hypertension. Let's go with the very basics. How do you know if you have high blood pressure or hypertension? Well, technically, the definition is two separate blood pressure checks separated in time of 130/80 or greater. Now, those numbers used to be kind of like 140/90, and then some recent studies were done showing that it's better to have a lower target. In certain populations of patients like diabetics or people with other forms of heart and blood vessel disease, we target lower numbers. So just because your blood pressure is 132/82 doesn't mean you're in perfect shape. You might need some attention to that blood pressure. Although it's not a horrible blood pressure, you could call it like early stage hypertension. Blood pressure of 120/70 is almost always normal, completely normal. A blood pressure of 150/90 is usually a big problem. In certain older populations, we do accept a blood pressure up to 155 on the high number and 85 on the lower number, but that's really in the super elderly, people above 85 years old who have thickening of their arteries. So you got to talk to your doctor. If you have high blood pressure, 130/80 or higher on any occasion, you really should be checked. Now, an occasional number that's high and you think it was just due to an erroneous blood pressure cuff check, that's not such a big problem. Don't check your blood pressure when you're feeling stressed or agitated or during exercise. Check your blood pressure when you're feeling relaxed and maybe just hanging out around the house. Also, check your blood pressure multiple times over time. Do you have to wait and talk to your doctor about buying a blood pressure cuff? Absolutely not. I don't really recommend the wrist cuffs. They're not as accurate in some people. So get a brachial cuff. It fits on the upper part of your arm. If you need help with fitting the cuff, there's instructions that come with it, or you can watch videos. In general, it's got to be loose on your arm, not too tight, and then you simply make the machine go off. Talk to your doctor if you think you have high blood pressure. It can be a very serious disease, but it's great to get checked. Always get checked.